Let's turn to this truly important conversation and fascinating discussion that is being raised by my next guest. It talks to public health care funding, the suggestion being that it plays a critical role in protecting women and advancing their safety and empowerment. Let's unpack that theme because it is quite loaded. I'm joined by, the budget analyst from Section27, Matshidiso Lencoasa. Welcome back. It's good to have you back on the show. I was saying off air, I read your piece that talks to budgeting versus the realities of safety and empowerment of women. We are operating in a country where we've had the National Strategic Plan on GBVF, as well as the declaration of gender-based violence as a state of disaster in South Africa. But practically, in terms of the rands and cents of our resources as a country, are we living up to that?
Yes, that's exactly it, and thank you very much for the opportunity. So last year, around the G20 time, South Africa did declare GBVF as a disaster or classified it as a disaster, and one would have thought, especially as a woman in this country, this is something we've been complaining about for years around our safety as women and some of the hardships, socioeconomic hardships we face. But then the budget that was tabled this year in February that followed that state of, or the commitment to a state of disaster did not actually allocate new funding, no additional funding towards this. And so we've been saying that the current response, the current scale, the current response in itself is not resourced effectively, or it's not working, and we're not seeing protection for women in the way that we could, living up to our potential and our safety as women in this country. And yet, it just seems that that budget, what it means is that provinces and departments have to reallocate from one other place to another, but the budgets are already constrained. The Department of Social Development is already closing down many shelters, NPOs that have had to close down because of budget constraints. So that little money has to go then towards care centers, and that also extends to the healthcare system. Because
naturally, when a disaster is declared, you expect that the resources will follow the disaster in order to enable the response. So when you're looking at whether or not the deployment of resources follows the declaration, which are the line departments, programs, layers of our government where we should be looking that signal that actually we've not followed through with the resources, requisite resources?
Yes, so I think that's an important question, because when it comes to gender-based violence, it really requires an all-of-society response and also an all-of-government response, because there are different interventions. Education is really important, so we would want to see education programs that are invested in life skills, comprehensive sexual education, etc., that should equip learners and people to be able to respond and prevent such behaviors. We would need to see healthcare as well, preventative, being able to spot the signs of gender-based violence when it happens. So we would like to see health professionals that are hired and qualified and are capable and not severely constrained and are capable and able to meet the need. Of course, we would like to see the Department of Justice and Constitutional Development. So really it requires an all-of-government response. And when we see a budget that these departments that I've mentioned, they've either maintained, they have not been any real adjustments to it. So we're really maintaining the status quo. We're not actually scaling our intervention. And so what's really changing, besides it being declared a disaster, if there is no resourcing or interventions that are actually going to accelerate this as a response that can actually address the socioeconomic hardship?
Let's hone in on the issue of public health care as one of the line items of our budget, our resources being directed there too. Because you make an interesting point in the piece that I read about its dual importance. One, talk to me about its importance as an early warning system, perhaps the only available early warning system for women in certain contexts. We'll turn to the other side, the flip side of the coin. But for now, let's talk about that element.
Yes, so it's very important, because I think people often overlook this aspect of it. But when we have, if there is some form of violence, gender-based violence, of course, women would seek care in care facilities, including, in a clinic, in a hospital, depending on the severity. And because the majority of people in our country are medically uninsured, so we cannot cannot afford medical aid or any other interventions, they rely on public health facilities for this intervention. And so when you have a nurse or when you get to the point and community healthcare workers are not well equipped or nurses are not well equipped, they can either overlook those signs or don't give the full attention.
When the system is under pressure.
When the system
There's
is
no
under
time
pressure.
to be looking for any other signals. I'm just attending to your physical health.
Exactly that. And so it overlooks some early warning signs, as you mentioned, describing them as such. And so a patient can come in and out and the same thing, and it doesn't really register, and they may not have the capacity or the capability to actually address that. And so in that way, we actually entrench gender-based violence, and we could be saving lives and be preventative or realize as and when it happens. But because we have a system that's been under pressure and defunded for more than a decade now, their priorities, and when it comes to priorities and in competing priorities, it's often the most marginalized and those who don't have a voice or don't have the same level of confidence to air out that who end up suffering the most.
And the other aspect has been a bugbear for budget watchers like yourselves, the austerity. I don't know if government likes the word austerity, but certainly many commentators describing it as austerity and how it's impacting the so-called care economy. And that's an important one, isn't it? Because that's partly where women are most active. And if that is subject to austerity, what is the result?
Exactly that. So that's also, we're fortunate that we've now come to a part where even the health minister has conceded that defunding healthcare and austerity measures have constrained our ability for our state to deliver on accessing quality healthcare services. So we're now at the point where I think there has been concession, which is good, but we also need course correction because it's been a decade. It's obviously not working, and we need to invest in, invest in our people. And one of the ways, the healthcare sector and public healthcare system is a site of struggle for women on two folds, because women are generally, because of the gender norms in our society, it is women who typically take a child who is sick to a clinic, or a sick relative. It's a granny or an auntie, a mother who does that. And so when the state rolls back on its investment or doesn't recognize that work that goes into it, it means that they have to find, be it from the child support grant that was supposed to go towards some other thing to make this work, to keep our society, the children alive and our society alive. But also at the same time, when you walk into healthcare facilities, a community healthcare worker is most often a woman. I think more than 95% are women, and the same as nurses. Nearly 90% of nurses in our country are women. And so when the state rolls back its investment again, it is these women who act as shock absorbers in response to this austerity.
Parting shot, Matshidiso, you talk about course correction. What does that look like? The answer seems almost to commend itself, but I don't want to assume. What does course correction look like?
Yes, so there are definitely a lot of interventions. For example, we need to do more than just give speeches during Women's Month, but actually invest in a way that shows that we take, empowering women empowers the nation. How do we do that? Well, the medium-term budget speech, the upcoming budget speech, can be reallocated so that it can be clear how this disaster that has been classified of gender-based violence is actually going to be funded. And so we'd like to see some clear allocation around that, but also allocation that we can report and hold the state accountable to. So it needs to be clearly clearly line items so we can follow the money and not wait until the Auditor General then says this money was underspent or there was corruption. We can monitor it as and when it happens. But ultimately, we need a government and a society that listens to the people. So we need greater public participation. So when there are budget decisions that are made, and when they say, for example, that gender-based violence is now declared a disaster, government needs to be speaking, including National Treasury. They need to be speaking to women's groups and women in this country to say, okay, if this is a disaster, how can we best position the state to actually address those problems? So really, there is a way to actually course correct, but we really just need the political will to do that.
All right, Matshidiso, thank you for coming through as always. Matshidiso Lencoasa is budget analyst at Section 27, helping us with leading this really important conversation. Follow the money. Follow the money. Does the money follow the commitments that you've made on this really important issue of our national life?